welcome to this episode of A Cancer Conversation. For those who don't know, my name is Chris Curry. I am the Communications and Marketing Manager here at the Georgia Cancer Center at Augusta University and WellStar MCG Health. Thank you for watching, thank you for listening to A Cancer Conversation. It is a podcast series by the Georgia Cancer Center where we try to share information about cancer, both on the clinical side as well as laboratory science, population health science. Today's conversation is going to be about lymphedema, and joining me for this episode are Dr. Hari Kashyap and a special guest who we will introduce in just a second. But Dr. Kashyap, recently a doctor too, by the way, we'll talk about that. He is a lymphedema specialist working here at the Georgia Cancer Center, helping patients who develop lymphedema as part of their treatment. Dr. Kashyap, thank you very much for coming on today's Cancer Conversation episode to share some information about lymphedema.
Thank you for inviting me, Chris. I'm glad to be here.
And Hari, I understand that you brought a friend along with you for today's conversation, is that right?
Yes. Naomi's here with me. She is my patient, whom I had seen for lymphedema after our breast cancer surgery. So Naomi, thank you for joining us. Yeah.
Naomi, tell me a little about your story and your experience with lymphedema. You said breast cancer. When were you diagnosed with breast cancer?
Last year in May. And after I had my surgery, I had lymphedema on my right arm. It was also going down my left side as well, but I found out I was diabetic. And so you get neuropathy when you're diabetic. But he has helped me a lot because I wasn't able to lift my arm. I didn't have a lot of mobility. So he helped me with a sleeve that I put on every night. And I exercised my arms just so I could be able to move it around.
And I understand, I heard your story. We actually have it on our Georgia Cancer Center YouTube channel, so please look it up, Naomi Nieves. You were also pregnant at the time of your cancer diagnosis.
Twins.
Oh wow, with twins, yeah. I was watching your story earlier today as part of the preparation for this interview, and it's just so inspiring what you were able to go through. So thank you very much for being here today.
You're welcome.
And we'll talk about your story, we'll talk about lymphedema, we'll talk about your experience with lymphedema. First, Hari, I want to talk about you. Talk about your decision. What led you into a career in the medical field caring for lymphedema patients?
That's a great question. I wanted to be able to help people. I have been in the healthcare field for many years, and I wanted to develop a specialty where there was shortage of healthcare professionals such as lymphedema therapy. For two reasons. One is that you are able to help those people who are not able to get the correct kind of therapy, and second is it helps you build up your own specialty. So that was my motivation, and it makes me feel good when I'm able to help other people and they are able to improve their health and lead good lives and get back to work. So that was my motivation, and I'm glad I did it because it has been very fulfilling. I started my PhD, a lot of research focus, publication, so it has been very fulfilling. There is a lot more work that's coming up, so it's really a good thing.
So, Naomi, I understand that we were talking before we started recording that you actually work here at WellStar MCG Health. So what does it mean to you to have the Georgia Cancer Center right here in your own work backyard?
It makes it easier for me. I actually had my surgery at doctor's, and I had requested to come down here because I work here, so it's much more easier for me. I know the people that work here, and we all get along, and it's just much more comforting for me because they all work with me. Even the doctors that are not my doctors, they're very comforting, and I've never had a problem with any of them, and it's just easier for me.
Good. So let's start this conversation by by beginning at the beginning. So when you're in school, you learn about all the different systems in the body, the cardiovascular system and the brain and the spinal cord and all that. For lymphedema, we're talking about the lymphatic system. So talk a little bit about what the lymphatic system is, Dr. Kashyap.
Yeah, that's a good question. So there is not much awareness about lymphatic system. Lymphatic system is part of the vascular system, and most people don't realize that we have a lymphatic system until we develop a problem. So this system helps drain the lymphatic fluid. I'm sure you heard about our bodies made up of 65 or 75% of the fluid, and that fluid is drained by which system? Lymphatic system. So a majority of the fluid is drained by that. Anytime there is any kind of damage, disruption to that system, that's when you have this buildup of fluid. So you have more fluid and less drainage, bottleneck type of condition. So that's what swollen limbs, arms, or other body parts happen.
And Naomi, how aware were you of lymphedema when your condition started? Because, did they talk to you about it before surgery? Were you kind of aware that it could be a thing? How much did you know about lymphedema?
I honestly did not know anything about lymphedema. I was just in shock of everything going on with me. It was one thing after the other. I was like, okay, what more do you guys have to tell me that's going on with me? So I had no idea. And the reason I didn't know so much is because I was more upset of doing the surgery, and they didn't know how bad it was till they did the surgery. But they didn't tell me about me having lymphedema. They didn't tell me what were like the side effects of what would happen, because they didn't know. They didn't know how many lymph nodes I had that had cancer. They had no idea. So when I did the surgery, they told me it'll only be a couple hours. It ended up being about 6 or 7 hours.
Oh, wow.
Wow.
So, they said it's because it was going down my arm, and that's what messed up my arm.
Okay.
That's the whole reason. They're like, okay, so you're gonna have all these issues because of us having to take so many lymph nodes out that were cancerous.
Okay. And I understand from discussions that I've had over the years that it's more common for solid tumors like breast cancer for those cells to migrate and move around the body through the lymphatic system. Is that correct?
That is correct, yes. That's why now the new technique that surgeons use is called sentinel lymph node biopsy. So they look at the surrounding lymph nodes to the tumor because the fluid is draining into them. So if the cancer cells are found in them, they know that cancer is spreading out into those lymph nodes. If not, they know they don't need to remove them and they are healthy and fine. So this technique actually helps patients because less tissue is removed, less lymph nodes are removed. Earlier, a female had a breast cancer, a lot of lymph nodes would be taken out. Axillary dissection, a lot of axilla would be taken out. And so more lymphedema would happen. But now there is more innovative surgical technique that is, I know it's done here at our institution, and it helps a lot of patients. Did you have the sentinel lymph node biopsy?
Yeah.
Okay. So each individual case is different, and the surgeon decide what is the best approach for each patient.
Yeah, and that's obviously what can cause the surgery to take longer because you're learning things as you're going along.
Exactly.
So talk about how lymphedema develops. What causes it?
That's a good question. So what causes lymphedema? Let's take Naomi's case. She had cancer. You had stage 3?
Stage 3.
Stage 3. So having a cancer, having advanced cancer stage, did you get radiation or chemotherapy?
Both.
So you got both, okay. So if you have advanced stage cancer, on top of that, if you get radiation therapy and you get chemotherapy, and if your chemotherapy happens to be for prolonged duration, if your radiation therapy happens to be for prolonged duration, your risk goes up with that. If you had a breast cancer and it was stage 1, and you had lumpectomy done, not mastectomy, you did not have radiation, you did not have chemotherapy, your risk would be minimal. In fact, a lot of patients that I see that have had lumpectomy and they are afraid of getting lymphedema, with confidence I tell them your risk is extremely minimal. And I would say 99.99 of them don't get lymphedema because there is much less damage has been done to the lymphatic system. Lymph nodes have not been taken out, just a small tumor taken out, it hadn't spread around. So the drainage system is intact, it's working fine. Risk is less. It's important to know, Chris, what you brought up is very important. So not every patient that has breast cancer is going to have lymphedema. Every patient that has prostate cancer is not going to have lymphedema. It's important to realize that. A lot of patients panic and they approach me and they start to feel like, no, my arm is swelling, my leg is swelling. And sometimes that can be psychological or real or both. So it's important to know that if about 100 patients have what you had, maybe 25, 30 are likely to develop. It can vary based on their stages of cancer, how much treatment was done, how active they are. You use your arm a lot, right? You're always on the computer, you're working, you have a young child, you're working, so you're using your arm. Some of these patients that I see that are older or inactive or have other conditions, they're not moving as much. That makes the risk go up.
And I know we're talking about breast cancer and you just mentioned prostate cancer. What are the cancer types where lymphedema is more common? Obviously, it varies from patient to patient, but what are the types of cancers where lymphedema could be more likely to develop?
Excellent question. In Naomi's case, obviously it was a breast cancer. In males, you see more prostate cancer, and especially more advanced stage cancer, reduced mobility, obesity, other factors happening there. Head and neck cancer, when patients have cancer of tongue, cancer of jaw, cancer in the voice box, larynx, head and neck cancer frequently lead to lymphedema. Patients sometimes can even have what's called internal lymphedema, which means that externally it's going to look just fine, but they might complain, I have difficulty swallowing, it's dry, achiness, tightness. So I did some research during my PhD and I found out there is actually a condition, I didn't know about that, internal lymphedema, not visible. So when our head and neck surgeon are putting the scope and looking inside, they refer the patient to me and saying, this patient has internal lymphedema. Externally, they were perfectly fine, but patient was complaining of problem. So head and neck cancer, prostate cancer, gynecology cancers, a lot of the ovarian cancer, uterine cancer, those patients, again, depending on stage of cancer, radiation, chemotherapy, BMI, healthy lifestyle, those factors determine the extent and the occurrence of lymphedema. Other cancers that can be associated with lymphedema, sometimes you see sarcoma, the muscle and bone type of cancers can lead to that. So those are the common ones that I can think of right now.
Okay. And Naomi, how soon after your surgery did you notice that something was wrong and that you needed to seek additional information and help?
Oh, right after, and I had spoke to Dr. Ravel, that's my oncologist here, and she had referred me to Dr. Kashyap.
Okay, so almost immediate.
So how far after your surgery did you see me?
A month?
Month or
probably
week?
a month.
Okay, because you started to feel heaviness. So, and then since then you haven't had, and you've been using your sleeve and doing exercises. Yeah, so somebody like you has a risk for rest of your life. Why? Because those lymph nodes are not going to regrow. and what has been surgically removed is gone. So the environment inside your axillary area is ideal to create lymphedema. So what can you do to keep it under control? There is no cure for it, by the way. There is no cure for lymphedema. So we can only manage the symptoms. So you said you exercise, you use the sleeve, and because you don't have pitting edema where you have indentation
Yeah.
or much fluid, you may not need that much manual lymph drainage or compression pump. But if you have increased fluid, you might need a pneumatic compression pump. You might need to come back and see me. And skincare wise, you never had any kind of open skin ulcer or breakdown. Okay, so that's good. And never had any kind of scar that caused limitation of your arm mobility, shoulder, overhead reaching.
Well,
You didn't have,
I still have that scar that I have there.
but does it restrict your mobility?
It does, because
Like
I can't
when?
lift my arm all the way up.
Like if you have to reach up into the cabinets in your kitchen, it's
It
hard.
hurts. Mhm.
Yeah.
Like I can't, like this arm, I can pick it up with no problem
You're pretty
and
flexible.
leave it
there,
like that for a while. I can't do that with this arm.
Okay, yeah, so the other thing about lymphedema, it's not just the swelling. You can have associated symptoms such as scar formation. And when you have scar, anytime you cut body's response is to overbuild the scar because body is worried. It wants to close that gap in the skin tissue. So it always overbuild. You look at the scars, they're almost always more than what normal skin, how it's closed. And that scar contracts. It has a tendency to contract everything. So it's going to pull the skin towards it. And as a result, you will not be able to raise it as high up.
Yeah.
So that's what happened in your case. So which means that if you were working in an industry or your job requires you to work where you have to raise your arm, you have to press some buttons, then you might end up actually losing your job or you might need a different job. If somebody is a homemaker and he or she has young child or kitchen work and everything else, it can be restricting. Patients can avoid using their arm. And when you avoid using your arm, your muscle strength can go down. When muscle strength can go down, you can actually drop pots and pan. You can drop stuff. Did you that ever happen?
Yes.
You were dropping stuff?
Yes.
Yeah. So when I see patients, other than lymphedema and swelling, I'm always educating them about muscle strengthening, coordination, and proper biomechanics. And it's such an individual thing that it varies from individual to individual. Some patients I have just swelling and nothing else. And some patients I could have no swelling, but they have such a huge scar, radiation burn. They could have leakage of fluid. They could have bleeding. And they could be just babying their arm, and they're just not using it. So it varies individually.
So Naomi, take me back to your first appointment with Hari and what that was like, and then talk a little bit, and you can assist obviously, talk a little bit about what your treatment process for lymphedema, what he taught you to do, how often you had to do it, sort of talk through your experience with lymphedema.
Okay. I still had my bandages from my scar, because that'll tell you how soon after I had seen him. He was just helping me. He gave me like some information, some paperwork for me to do exercises. He gave me the sleeves to help me move my arm. And it's because how the surgery ended up. And then of course, I still saw him after I did radiation, because radiation messed up my arm too. Because of what happened, the way they did the surgery, the way radiation, I can't even get breast implants, which messed me up. So, and it's because there's a whole gap right there. Like he said, the muscle stretches out, and it does. And it still does. Like he said, that's something that I would just have to deal with for life. It's something that I hate that I have to deal with it, but I have to. But he also did some compressions, like he put this machine on me that, what is it?
Pneumatic compression pump.
Yes.
It mimics the manual lymph drainage, light massage that facilitates that drainage of lymph fluid back into your lymph node so it can be filtered and processed.
So he used that on me so it could help me.
And what kind of exercises do you teach your patients? What kind of exercises did you have to do for your treatment?
Lifting my arm. Like he told me, like on the wall, lifting my arm.
Okay.
Said it helped my arm. And so that's actually what helped me the most. So I could be able to lift my arm. Because if I didn't do that, it would have stayed the way it was.
Yeah.
Yeah, you are a good patient. You did your part well. Just couple of points here. Going back to post-surgical swelling, it's important for patients to realize that when you have your surgery and you are going to develop swelling, that's not lymphedema. It's important to know what is not lymphedema. It is normal to have swelling right after having your surgery. And that is not lymphedema, so you need to give it some time, give it about 4 weeks, 6 weeks. And that's why when I have my patients, post-op, I see them about 4 to 6 weeks afterwards, because it can be misunderstood as lymphedema when it is a normal body's response to healing process. That's one point. The other thing is the exercises you mentioned. So exercises are light, no weight is involved. It is designed to engage all the muscles. So when muscles move, it squeezes the lymphatic vessels. When lymphatic vessels squeeze, the fluid has to move. So that is the purpose of doing the exercises. They are called decongestive range of motion exercises. Additionally, deep breathing exercise is good. Patients have anxiety, but deep breathing exercise stimulates the core of your lymphatic system. That's where thoracic duct is, transportation of lymph fluid. So deep breathing exercise is excellent exercise for cancer patients, for patients with lymphedema.
And obviously it sounds like a lot of this, they come to see you and you do some exercises or some drainage with that pneumatic machine, but it sounds like a lot of the responsibility is on the patients to want to treat their lymphedema at home, doing the things that you recommend. So Naomi, talk about your drive and your determination to keep going and keep doing those exercises and doing the things that you needed to do.
I was determined because I wanted to be there for my twins. I'm a very determined person. I was so stubborn that I told them, I was like, I know I only have one breast, I want to breastfeed. And they're like, with one only? I said, yes, I breastfed my other kids, I want to breastfeed my twins. So when I'm determined about something, they told me, oh, you won't be able to hold your twins, you won't do this. I said, oh, okay, we'll see about that. Mm-hmm. And so I was like, no, I'm going to do these exercises, I'm going to move my arm, because I want to be able to do everything I did with my other kids with my twins.
And
I don't want that to,
kids?
5
Okay.
in total.
Okay.
So I didn't want that to stop me from doing things with my twins.
Yeah. Talk about how important that sort of determination and drive is.
It's very important. Like Naomi said, not everyone has the kind of determination that you have, which is excellent. Why some patients don't have that? Because when you have such a catastrophic diagnosis of cancer, on top of that having lymphedema, then losing your part of your body such as breast, it leads to psychological effects. It has mental effects. And for patients, it can be a major sense of their sexual identity. It can also lead to a less desirability of the partner, or the patient can perceive it to be like that, even if it's not there. I have seen both, a lot of supportive spouses, they come in and they're very supportive, very understanding, and then I have seen not so supportive. So the mental health, psychological impact of having breast cancer or having lymphedema, and especially losing your whole breast or other body part, is immense. And it's irreparable in my understanding. And we have Dr. Begum, she provides counseling and psychological treatment to patients who need it, and we refer patients to her. So that, like Chris mentioned, that drive and motivation is important. And you're gonna have those episodes where you feel like, I give up, I don't think I can do it, right? I think most of us have that. In a way, that's a human tendency, but a lot of us are resilient. We bounce back. We are motivated by our the person that we care for, our children, our family members. Like you said, I wanted to make sure I take care of my young newborns. I don't want them to be deprived of any nutrition or any caring and their upbringing, which makes you an excellent mother, and there are a lot of great mothers out there. So that's one point. The other one is the treatment that we talked about, adhering to treatment. So there are phases of treatment. It's not the same all the time. So let me talk about 3 phases of treatment. First phase is, you didn't see me pre-op, right? Okay. So first is, if you have breast cancer, if you have prostate cancer, if you have head and neck cancer, it's the advanced stage cancer, you're going to have a big surgery, you're going to have long radiation, a lot of chemotherapy. You should ask your surgeon, what is my risk for lymphedema? Can I be referred before the surgery happens? Can I consult a lymphedema therapist who is certified? Second thing is, you want to understand lymphedema, and don't just rely on Google, because Google can give you a lot of information, but all of that may not apply to your case, so you want to seek a professional help. So first step is pre-op, before the surgery. Second one is, after the surgery, you go and see. You may not develop lymphedema right away. It may take months, years before you develop it. So you may have, I have my patients come to me every 3 months. We call it surveillance program. We keep an eye on those patients, high-risk patients. We know they are likely to develop, so we have them come every 3 months. Now, so far the lymphedema hasn't happened. I saw them pre-op, now they are coming post-op, but it hasn't happened. Now, let's say at one point it happened. Now that changes my approach. At this point, I'm going to have come and see me 3 times a week, 4 times a week, 5 times a week. Why? Because their limb is very swollen, their face is very swollen. So I'm going to do intensive therapy. What is my goal? I want to reduce that swelling. I want to get that fluid moving. I want to bring that pain level down. I want to create more mobility through exercises. I want to apply compression bandages. I want to do manual lymph drainage. What is that treatment called? Complete decongestive therapy, CDT. It has 4 components: exercises, compression, manual lymph drainage, and skin care. Why skin care? Because there is a risk of infection, and people can develop cellulitis. There is, redness, itching, and that can lead to infection there. So now you are in a phase where you are seeing me, it didn't happen pre-op, it didn't happen right after surgery, but now lymphedema has happened. Now you're coming to see me 3 times a week. I'm doing treatment, but I won't treat you forever. Like Chris said, you will have to take over as a patient. It's a partnership. You and I work together. I am in charge in this first phase, where my goal is to bring your symptoms down, bring them stable, and now I'm going to teach you how to maintain that progress. How would you maintain? You do exercises. You use compression that I gave you. You use your manual lymph drainage or do pneumatic compression pump and skin care. So now you go into maintenance phase. You are in maintenance phase. When you saw me, you were in acute phase or intense phase. And now you are maintenance phase, because you are maintaining the progress you made. Now you could have a flare up, and then you may have to come and see me again, and then I'll restart. So 2 phases of treatment, intense or acute and maintenance phase. That was a great question, Chris.
And So Naomi, do you do your exercises every night that he taught you, or is it just once a week? Like, how often are you still doing the maintaining exercises and compression things that he taught you?
Be
well,
honest.
The compression, I put it on every night.
Okay.
And then the exercise, well, I normally exercise with my twins, so.
Yes.
You're always moving.
I'm
lifting,
always
yeah.
moving with them, so, and if I ever have a chance when I'm sitting down, I'm next to the wall, so I try to put my arm as much as I can up.
Okay. Yeah, I noticed you were
Try to-
putting it up kind of very far
Yeah.
earlier, so that's awesome.
So I'm
Let me-
doing
let me
much
raise
better.
it up. Can you raise both of them up for me? Let's see. Okay. Okay.
That's pretty
But I
up there.
still-
Okay, that's good.
It's getting better,
Yeah.
but, the stretch is what hurts me.
Okay.
Yeah.
So Hari, I know that just like with mammograms and colonoscopies, it's important to catch things early. What should people be aware of when it comes to lymphedema starting to develop, and what should they do if they are concerned?
I think it's always advisable to request a consult, see your lymphedema therapist, either before surgery or after surgery, and have them evaluate you, find out your risk level, understand what are the signs that you should be looking for. How do I know I'm developing lymphedema, so you can reach back to your provider. The other thing is, don't use ACE bandages. ACE bandages don't facilitate the lymph flow. They're kind of designed to compress at one point. We use short stretch bandages. So there are particular type of bandages that are made for lymphedema. So if people go to a dollar store or Walmart and get a ACE bandage, I do not recommend that. The third thing is having more weight or having lymphedema is not a sign of obesity. It's a disease, it's a clinical condition. So you should get it checked out, get it examined. Now, there are some patients who don't have cancer and can have lymphedema. Why? Because they can have vascular veins can go bad, so their veins are not transporting fluid like they used to. So you can also have a congestive heart failure and you can have fluid retention. You can have bad kidneys and you can have lymphedema. You can have multiple surgeries like multiple hip replacement, knee replacement, skin graft, and you can develop lymphedema. It's not because of cancer. There are other conditions that can cause. It's not same as obesity, so you need to get checked out. Ask your physician, can you refer me to the nearest lymphedema therapist who is certified? Do a Google search, go to Lymphology Association of North America, where I'm listed as a qualified provider, and others in your area, and get yourself checked out thoroughly.
Well, Hari, I appreciate the time today. I appreciate you sitting down, and obviously, Naomi, thank you for coming on
You're welcome.
with Hari and being a guest on A Cancer Conversation, this episode about lymphedema. And I wish you the very best. I wish you the very best with newborns. I don't have children of my own, but I imagine that twins are quite the handful.
Oh, yes.
So best of luck with that. And thank you all for watching and for listening. If you have any questions about lymphedema for Hari or questions for Naomi, you can send us an email, cancer@augusta.edu. We'll put that email address in the show notes for you. We also will link the story that we did with Naomi, so you can learn a little bit more about her. And we've done some stories with Hari about lymphedema that we will also link, so you have some additional resources. Anything to try and empower people when it comes to all different aspects of cancer care and research. That's what we want to do.
That is the key. I think you should use the right word. Empowering patients and their family members. How do we empower them? Through the right knowledge, through right understanding, and what to do and what not to do. I think that leads to empowerment of family members and the patient. And so you're right, Chris. That is where our role comes in, and we, I appreciate you actually taking this initiative to help our community patients out there. There are a lot of patients who are suffering. There is less understanding of this condition. It's kind of a rare, emerging field. The reason it's kind of rare and emerging is because earlier patients would have cancer and the survival was not so good. So patients would have cancer and die soon after because there was not much advancement in technology. Now the medical technology and science is so advanced, patients are living longer. As a result, there are more side effects like lymphedema, and these are becoming more chronic, lifelong issues that needs to be managed. So that's the reason, yeah.
Well, we will continue to do our best, and again, we have a bunch of episodes that we are getting ready to record that will be coming out in the coming weeks and months, so make sure to subscribe. And again, if you have any questions or topics that you want us to cover, you can also send that to cancer@augusta.edu. Anything we can do to help you feel empowered, feel knowledgeable about the different aspects of cancer care, and we will see you next time. So thank you.